back in the classroom, that means more questions about any germs that they could be bringing home. Here to offer some answers is Dr. Rick Malley, an infectious disease specialist at Boston Children's Hospital. Doctor, thank you so much for joining us. We really appreciate you spending some time with us. You've told us before that the data shows that classrooms are low risk for COVID infections. Students wear masks. The desks are 3 feet or more apart. Do you expect those protocols to protect kids from other viruses as well?
Yes, I think it's very likely. And in fact, one of the unusual aspects of this very unusual year is, as I think many of your viewers know, we have seen far fewer respiratory diseases, far fewer cases of pneumonia, and also far fewer cases of bacterial meningitis, almost certainly as a consequence of all the physical distancing that we've been practicing for over a year. And so I think it's very reasonable to expect that while these procedures are still required because of the threat of COVID-19, we will also see the same sustained reduction in viral illnesses.
Doctor, the number of new COVID cases that involve children is increasing, and 2 to 5 weeks after an infection, a small number may even develop a serious inflammatory syndrome. So I have a couple of questions here. What do parents need to know about that? And are there any risk factors, and specifically I'm talking about age or gender?
Yeah, that's a really interesting syndrome that we and many others have been studying to try to understand what might be explaining these inflammatory responses in children who appear to have had, in general, almost 3/4 of the time, asymptomatic COVID-19. So these children have clearly been exposed to the virus. In most cases, the parents were unaware that their child was sick with COVID-19. And then several weeks later, they may present with an unusual syndrome that requires immediate medical attention. We know that, roughly the ages span between 5 and 13 with a median of 9 years of age. It is also true that this condition is more likely to be found in the same communities where COVID-19 has been and is still rampant. So certain underrepresented minorities, for example, are at higher risk for this condition.
Well, I'm sorry, doctor. That's scary for parents. How does it present itself quickly?
So it presents in many different forms, including fever. You can have a rash. You can have children who actually present with either cardiac or lung, either heart or lung symptoms. And ultimately what parents are asking themselves, and we should also try to educate them on, is when to contact their physician if a child has fever and unusual symptoms. And in the era of COVID, I think it's much better to be safe than sorry. Contact your pediatrician, let them know what's happening, and if need be, the child needs to be evaluated.
Which kind of leads us to the next question, doctor. So if your child wakes up with the sniffles, what's the most likely explanation this time of year? People are going to, I don't want to use the term freak out, but they're going to get concerned, right?
Sure.
No, I understand. I mean, I think in general, one possibility is, of course, COVID. The second one is there could be other viruses, even though, as you point out, they're less likely now. In Australia, for example, they saw that certain winter viruses popped up in their summer, maybe because people were not getting them in their winter. So that's a possibility. And then allergies, of course, this time of year are rampant. And I think rather than, as you say, freaking out for the sniffles, I think one should look at, was the child exposed? Was the child around anybody who may not have been focusing on physical distancing? Was anybody in the family potentially at risk? Because ultimately, we still believe that the most likely way for a child to get sick is to have obtained it, unfortunately, from another member in the family who's an adult.
All right, Dr. Rick Malley, an infectious disease specialist at Boston Children's Hospital. Thank you so much, doctor. We appreciate it, and stay well.
Thanks, doctor. Great to see you.